Procedure on taking blood sample for culture and sensitivity. Introduction. The sepsis syndrome exists along a spectrum where the patient first has an infection which then leads to bacteremia, sepsis, septic shock, multi-organ failure and eventually death. Early identification and management of bacteremia is vital to improve patient prognosis. Blood culture are used to aid the diagnosis and management of sepsis and septic shock. Introduce yourself to the patient. Perform hand hygiene upon entering patient area or room. Rub hands with alcohol-based hand rub upon entering patient area. Check that the laboratory form matches the patient's identity. Get the equipment and check expiry dates of culture bottle, disposable dressing set, blood culture bottle, aerobic and anaerobic, sterile gloves, disposable plastic apron, Vicodin needle, tourniquet, alcohol hand rubs, alcohol swab, chlorhexidine 0.5%, sharps container, gauze, hyperfix, and lab request form. Perform hand hygiene. Prepare blood collection set. Pour 0.5% chlorhexidine gluconate in 70% isopropyl alcohol. First, open the dressing set. Arrange all items, Vicodin needle, gloves. Use sterile gloves as this is aseptic procedure. Pour 0.5% chlorhexidine gluconate in 70% isopropyl alcohol into the dressing set. Remove the caps of the culture bottles and rub the rubber tops of the bottle with a fresh alcohol swab to sterilize for 30 seconds. Use separate alcohol swab for the two bottles. Perform hand hygiene. Apply tourniquet to the arm of the patient and identify a suitable site for venipuncture. Perform hand hygiene, wear PPE, then sterile gloves. Wear disposable plastic apron first. Perform surgical hand rub. Wear the sterile gloves. Use the gauze soaked with antiseptic to sterilize the venipuncture site. Rub antiseptic to and fro motions. Do not palpate vein again after cleaning the patient's skin. Allow to air dry first. Insert the needle into the clean venipuncture area with an aseptic non-touch technique without touching the venipuncture area. Fill the aerobic bottle first and allow the pressure to fill 10 ml of blood into the bottle. Then remove and attach the anaerobic bottle to fill another 10 ml of blood. Thoroughly mix the culture bottles by gently rotating or inverting the bottles. Once completed, release tourniquet and activate the safety device on the needle. Use the gauze to apply pressure to puncture site. Apply hyperfix. Dispose all sharps into the sharps container and clear away all material. Remove gloves and wash hands. Document the patient's identification, date and time of collection, site of collection on culture without obscuring the barcode. Send bottles with a signed request form to the lab in a specimen bag within an hour of collection.